OCD screws everything up. It interferes with people's religious experience. It makes it miserable. It wrecks their relationship with God. We want to help them identify the OCD part, violate that without violating their values, so they can cut it out and they can live the values-driven life that matters to them.
OCD is one of those things that just doesn't know how to move on. Just grabs one bad thing and says, yeah, but what if that happens again?
The themes that you folks with Scrupulosity are struggling with so much. Am I a bad person? What am I really capable of? Like, these are things that philosophers, theologians, people have thought about for millennia. And the difference is that you guys want an answer. You're not going to pray your way out of OCD. OCD is opportunistic. OCD latches onto what's important to you, especially if you're particularly religious. If you have OCD, that's going to be stuff OCD can use against you.
Hello, everyone, and welcome once again to another episode of the Get to Know OCD podcast. Today, I have this guy here who keeps bugging me, asking, it's you, Jed. Jed, hello. How are you?
I'm all right. Thanks for having me, Patrick. Good to see you.
It's good to see you, too. I always love to give people the time to introduce themselves. So why don't you let me you hand it over there first, and then we'll do a couple of other little things.
Okay, sure. I'm Jed Sieve, as you said, and I'm a licensed clinical psychologist. I live in the greater Philadelphia area. I'm on faculty at Swarthmore College, and I also have a visiting faculty appointment at Johns Hopkins. Mostly I study OCD and related disorders, and my visiting position over this past year when I've had sabbatical at Hopkins was studying psychedelics, and psychedelics for OCD as well.
Awesome. Well, Jed Sieve, thank you for being with us today on the Get to Know OCD podcast. For those of you who are watching, welcome once again to another episode of the Get to Know OCD podcast. If you like what you see here, you can subscribe to our NOCD YouTube channel. And if you're looking for help for OCD and related conditions to be treated by people who are expertly trained, check us out at NOCD.com. Now, Jed, you and I have worked together. We've done talks together. We have really focused a lot on scrupulosity, which is OCD about morals or ethics or religion, for those who are not as familiar with it. And I do want to get into that, but our crack background team was doing some research on you and saw that you had written an article on climate anxiety. And everyone was really interested in that. So I was wondering if we could maybe start there and then we can pivot over to some scrupulosity things. But can you tell us a little bit about what you're seeing on college campuses and climate anxiety and the concerns that are going on?
Sure. Yeah. It's a little bit out of my typical wheelhouse. And I have students, though, who are really interested in it. And so climate anxiety in general is anxiety about the impacts of climate change. And sometimes that can be sort of general existential fears, what's going to happen, an existential threat to humanity, to the world, those kind of things. But where I see clinically this sort of thing come up, and I suspect you may as well, is in the context of OCD and scrupulosity, secular scrupulosity, where people then, their obsessions can latch on to things like whether or not they're contributing in a negative way to or responsible in some way for negative climate-related impacts, whether they're doing enough to remediate, to encourage other people to, and those sorts of things. So clinically, I see it more in the context of OCD, actually. Okay.
And how, for people who aren't as familiar with this, we don't have a subtype yet of climate OCD, but how might the obsessions appear and what might be some compulsions that folks might have around this if it does go more into the OCD realm?
Yeah, I think some examples that would be pretty typical might be really excessive and rigid efforts to and lots of obsessional concerns about whether the person is recycling everything that's recyclable, sometimes compulsions, not just for themselves, but people walking down the street and have the need, I guess, to go pick up anything on the ground, in the street, in the gutter that could be recycled. And I think that those are some pretty common or variations on those, or some pretty common versions of it.
And do you see a lot of worry about the future that many of the young people on college campuses have now in terms of what the climate will be like for them as they get older, or even for their children or grandchildren, and what we're leaving for people?
Yeah, a lot of that, and it's complicated because it's a situation that's a little hard to figure out exactly what the right dose of anxiety about those things would be. Right there, from a public health standpoint, you need people to take this seriously and people to be inspired to try to come up with solutions of all sorts. And in some ways, this is true of all kinds of scrupulosity, and here not just scrupulosity, where something can be somewhat values consistent, but somebody can be stuck going way overboard with it or being incredibly rigid about it. And what got us thinking, us meaning my students along with me, what got us thinking about what might contribute to climate change is a little bit of that tension. There are things that are the usual suspects that create and maintain anxiety, and they're really, really, it's like really fertile ground for those things in the context of climate change. Stuff like uncertainty, difficulty with uncertainty. And no matter what no matter how much you read in terms of the science of climate change, no matter how much you sort of believe in the issue as something that's worth paying attention to, nobody has a clue exactly what's going to happen when. So there's a tremendous amount of uncertainty, and there are really high stakes. So if something is all else equal, if it's a really huge threat, obviously that's going to contribute to more anxiety, and this could be a catastrophe. And so just in terms of catastrophizing and that sort of way of thinking.
Sure.
So there are a lot of the usual suspects that contribute probably to all kinds of anxiety, and it's very easy for them to latch on to this theme. But I say that to introduce that there are some that are not the usual suspects. And you brought up things like, wanting to leave the planet or leave things better for future generations. And so there's this construct called generativity. And generativity.
Okay.
Yeah, it basically refers to the desire to leave a legacy, to leave things better for your kids, that sort of thing. And it's often thought about in the context of people getting older and sort of over the developmental lifespan, and it's usually associated with positive things. So as people are getting older, they're focused more on their legacy, what they're going to leave behind, how they're going to leave things for people, and usually more of that comes along with less anxiety and less depression. And here with climate anxiety, we have an interesting case where being very concerned about the legacy that you leave and how you're going to leave things for future generations might contribute to more climate anxiety. And in fact, those are some of the things that we were studying and found evidence for.
Interesting. So obviously a lot more to learn in this topic. It's being pretty new in terms of how we're studying it from a psychological point of view. I know so much time and effort has been spent on atmospheric studies or various things, but it is interesting to take a look at how is this going to affect the mental well-being of the people affected by it as well.
Yeah, exactly. And again, it's all about dosing it right. There can be things that are important to you and that you want to work on better, maybe character traits about yourself, maybe things you want to be better as a friend and a family member and all kinds of things. But you have to be able to sometimes set that aside and focus on other things and not be consumed by it always, and be able sometimes to bend the rules appropriately, at least, just to function well. And and so, like with other kinds of, and that's why I think of it as similar to scrupulosity in some ways, where somebody may have a values consistent urge to have a relationship with God if it's religious, or to be a better person, work on improving themselves. But sometimes you need to be able to focus on other things, and sometimes you need to be able to put those real desires and real goals and values on the side, and that flexibility people can miss that flexibility sometimes here.
And one last thing on this topic before we switch into more scrupulosity work, but are there strategies so far that you've identified that can help people deal with this anxiety around climate issues?
So I can't speak from data. We haven't
Okay.
evaluated any sort of strategies,
Mhm.
but I would think it's similar ones to how we would help somebody who's stuck with other sorts of scrupulosity or again values related anxiety.
Well, with that, we've both done work on scrupulosity. I wanted to dig into that because OCD does love to dig into things that are important to you. So if the climate's important to you, if your faith is important to you, if your morals or your ethics are important to you, what got you interested, first of all, in working with scrupulosity and doing the work you've done so far?
Yeah, well, when I started grad school, I wanted to study pediatric anxiety and had no interest in OCD at all. And I lucked into having the opportunity for my first couple of research clinical practica to work with outstanding OCD folks, and sort of fell in love with that. And it's so rewarding how much you can help people change their lives. And similarly, I just fell into getting to work with people who were specializing in scrupulosity, and to have a lot of religious patients who were stuck there. I had a background growing up and educationally in the Orthodox Jewish community, and there was sort of a pipeline of Orthodox and ultra-Orthodox Jewish folks with scrupulosity who were coming to the center where I was training at. And so I got to work with them and sort of had some insight that not everybody has on the religious side to understand. And I guess, it sort of snowballed, and
Yeah.
it became a real fascination for me.
I interviewed Ted Witzig recently, so we were talking about scrupulosity from a Christian fundamentalist almost point of view. Tell us what might be unique from your background in Orthodox Judaism and scrupulosity.
So Judaism is very, people talk about sort of orthoprax as opposed to orthodox. There's a
Oh,
lot of rules and regulations, things you have to do, and you have to do just so. And so there are some things about that create challenges, and there's some things about that make it easier to deal with, but certainly somewhat unique. So it's fertile ground. Throughout every single day, there are many, many opportunities for obsessions to latch on to a particular thing you're supposed to do. And did you do it the right way? And did you think the right thing when you did it? All that sort of stuff.
of course.
Very, very, very sort of regulated in those kind of details. So it's fertile ground in a way. The other side of that coin, though, is that there are sort of legalistic rules and guidelines. Different rabbis might disagree about exactly what they are,
Mm-hmm.
but they exist within any subpart of the system. And so it's a little easier sometimes to not have to have as subjective judgments. For example,
Sure.
Protestants with scrupulosity may be thinking like, did I offend God?
Yeah.
And that,
So wide topic there, right? Yeah.
yeah,
Mm-hmm.
exactly.
Yeah.
How you decide that is really, really difficult. And so to the extent that something is a behavioral thing, did I satisfy my requirement when I uttered it in the following way? It could be, it's a little more closely tethered to operationalizable kinds of guidelines. But the Orthodox and maybe Jewish version of scrupulosity more generally is one that is very sort of behavioral. It's
Okay.
very much about the rules and the rituals. Obviously, I'm painting in broad strokes. Anybody can have
Sure.
any version of this.
Of course.
Whereas what I imagine we're talking about with Ted, a lot of blaspheming in a general sense, offending God,
Mm-hmm.
truly
Unpardonable sin. Yeah.
unpardonable sin,
Mm-hmm.
worshiping devil.
Yes. In Judaism, then, and I like what you said, orthoprax, like there's so many practices. Are the practices done because they are rules and rules are to be followed, or is it a fear that if I don't do the rule right, it will be offensive to God in some way, or is there kind of a mix of both of those?
Yeah, I would say the spirit of those kinds of options you can find, echoes of both of those in
Okay.
rabbinic writing, but But if the dominant experience of doing it is one of sort of fear and misery and terror that drives it, then that's probably a sign that there's something off.
Okay.
There is a value within the system of sort of awe and fear, but a healthy version of that, not one that's basically OCD masquerading as religion.
Mm-hmm. And the rules I've seen can be very impactful and expensive. I've talked to people who have thrown out multiple sets of dishes in their home because of a fear of, say, cross contamination. So there's a lot that goes into some of these rules and making sure they're done in the right way.
Yeah, no doubt about that. But if you're throwing out multiple sets of dishes, that's a huge red flag to me, because that's not what is a normal way of observing those same rules.
Right. Yeah. So how do you help people, and I'm glad we're having this conversation, but how do you help people really recognize when they've crossed over into OCD versus religious practice? I mean, that's probably a universal question for any of us who treat scrupulosity. And what do you kind of look at in that area?
Yeah, well, and that's a huge thing, because so often the person experiencing it really has trouble telling them apart, let alone people on the outside telling apart religious ritual from compulsive ritual. So there may be a few kind of heuristics that can be useful for that sort of thing. You can certainly benchmark against what other people do. And if a person is acting in a way that's inconsistent, that's excessive, that's overly rigid compared to other people in their part of the community, it doesn't have to be compared to some general mean, but whatever group you're part of. So obviously that's a huge red flag.
Mm-hmm.
I think the motivation behind it really is big. So, you can hand wash appropriately, you can hand wash inappropriately. If you're a surgeon and you're going to operate, you should be scrubbing up. And in that context, it'll look very different from how other people are washing their hands. So it has to be sort of calibrated to that situation, but there's nothing inherently bad or pathological about hand washing. It really depends how you're doing it and why you're doing it and when you're doing it. And that's the same thing for the religious rituals. It's the same thing for prayer. Prayer can be a compulsion. Prayer can be prayer.
Mm-hmm.
Depending on how you're doing it, how much you're doing it, and those sort of. You wouldn't say if somebody's washing their hands 20, 30 times in an hour, not because they're doing something that requires that, you wouldn't call them very clean. You'd say they're compulsing.
Right.
And it's true of prayer or anything else. So sort of benchmarking against other people and some sense of motivation. And then I guess the third main criterion that I'd point out is just functionality. So I don't know, maybe there's sort of weird cults or something like that. But if you're talking about bigger religions that have roughly stood the test of time, most people are functioning okay vis-a-vis OCD kinds of things. So, you can like the messages or believe the teachings of the religions or not. But there's, tons of Catholics and tons of Jews, tons of people of all religions of that sort who are doing just fine without getting sucked into what you and I are then seeing when we see the scrupulous version of that.
Yes, when you have to be holier than the Pope, we might have some problems that we have to deal with, right? Yeah. That makes a lot of sense. How much of it, Jed, do you see then where it gets even very personal, a judgment against self, like, am I a bad person for doing this or having these thoughts or images or urges? And how do you help people navigate past that?
Yeah, so it's for sure there for a lot of people. I will say, before fully answering your question, that sometimes I see, because there are so many behavioral proscriptions and requirements and stuff, sometimes that stuff can get lost in the Jewish versions of scrupulosity, where it's so attached to just the legal details.
Okay.
And it's almost like, where was God in this picture? Or even, where is sense of self in this picture? So it's not always the case. Mm-hmm. But one of the challenges for stuff like scrupulosity, and I think this is true of other kinds of unacceptable thoughts, OCD as well, like real violent kinds of themes or sexual themes often, is that people feel like they threaten their sense of self. It's a question of who I am, not just whether I'm going to get sick or whether this is dangerous in some way. My identity is on the line. My values are on the line. And so one formulation of that is certainly, what if I'm a bad person? And And that's, of course, a very binary question, even, right? As if people
Totally.
are good people or bad people, when, of course, people are people, which means they're flawed. And sometimes we might call somebody bad in an extreme case, but there's like a whole spectrum. And I'm not better positioned than anybody else to decide who's good and who's bad, even if we were going to make that binary decision. So I think a lot of what I try to do with folks who are struggling with that is help them figure out how to articulate their beliefs. What makes somebody a bad person? Are there different kinds of bad? Does this particular thing that I'm so obsessed about that I think makes me a bad person? Do I think that when somebody else I know has that same experience, that makes them a bad person? And if they're double standards, what does that tell you? And what do you make of those? Why are you, sort of holier than the Pope, to go back to what you were saying,
Mm-hmm.
pay for them, but not for you. So spending more time on essentially moral decision making, how you're thinking about it, what it might depend on. You're having these thoughts and you think they might be so terrible. What are the alternatives? What do you think of other people? What are you expected to do? Those kind of things.
And I think one of the insidious natures of OCD is that there is an actual answer to all of those questions.
Exactly.
And that is what drives people into all these compulsions, because they feel as if they haven't just quite hit it yet, but they could if they do it one more time or something like that.
Exactly. I love that. I remember John Grayson has often said stuff like, the themes that you folks with scrupulosity are struggling with so much. Am I a bad person? What am I really capable of? Like, these are things that philosophers, theologians, people have thought about for millennia. And
Right.
The difference is that you guys want an answer.
Yeah.
Or
And today.
Yeah.
Right. Is the answer. Yeah. How do you help people then? And specifically, I would say in the Jewish community, how do you help people fundamentally accept uncertainty and doubt and move past the idea that the thoughts are real, right? And they must be attended to.
Yeah. So, I mean, they have no choice. They have to accept uncertainty and doubt because life is full of it.
You got it. Yeah.
So then it becomes a question of how to get better at doing it in the areas where I'm stuck and I struggle. And some of that is the decision making. What are your actual beliefs about how much doubt is acceptable and that sort of stuff. So it might be about that. And sometimes it can be really helpful. It's certainly the case. It's an advantage for me being more familiar with the rabbinic literature, that there's a lot of rabbinic literature that can be drawn on as precedent for that sort of thing. There are all sorts of rules about what you're supposed to do, but there are also all sorts of rules about when you actually have to worry one way or the other, or what amount of doubt is okay. And, if I won't sort of bore you with the mechanics of that, but there's plenty of precedent to draw on. I suspect that's true of a lot of traditions. So you're going to be stuck handling doubt and uncertainty anyway. What do you believe is an okay way to do that when it comes to things like religion and God and sin? Yeah. Sometimes it can be helpful to consult with clergy, let's say, but ultimately it boils down to practicing getting more comfortable, not being so comfortable, and not being so sure of those things.
And I'm glad you brought up the word sin. I think back to old translations, Aramaic, this idea of sin being you miss the mark, versus what it feels like for many people today. Sin means you're going to hell, right? Can you may have more knowledge than me on this, on the translations of things, but can you speak to that and what you've seen in various faiths in terms of the evolution of this concept of sin at all?
I don't think I'm a good enough religious scholar to do that justice. But this won't land equally across different groups, so that it'll have to the language will have to be tailored, no doubt. But maybe this is still part of the moral decision making. Like, what do you imagine that God expects? So let's say God says you don't do X. Mm-hmm. There's all kinds of mechanisms in the religious tradition for what you do when you screw up and do it. So, Catholics have confession, and with Jews, we just passed Yom Kippur, and there's a whole there's a whole service that has to do with atonement and confessing your sins.
Mm-hmm.
And so, yes, there are aspirational things and maybe even just requirements. You're not supposed to do this. And then these systems also have to have built in, you're human beings, and so you're going to get stuff wrong sometimes. And so there are mechanisms to set things right. I mean, I don't know for sure that's why they developed that way, but that's the meaning I take from them. So I don't think it has to be that just because there are rules about what you're supposed to do or you're not supposed to do, that means that if you break one of those rules, you're a horrible bad person. It's irredeemable, or some of the inferences that people take from that.
Yeah, well, that hits it on the head, I think, very much so. This OCD takes it there because the nature of OCD is only to go to the worst case scenario. I'm going to bet you, like I, have never once had a person in our office on our Zoom call say, I'm really afraid everyone loves me and thinks I'm great as part of therapy, right? Yeah.
Exactly. Right.
How about faith leaders and the interaction with them? What has been your work with faith leaders in helping to guide them, educate them on the psychological nature of some of these things versus someone just saying, you're just not practicing your faith enough, practice it and more, and then everything will be okay.
Right. As with any part of life, there's a range of people and backgrounds and flexibility of thinking. So I don't want to be, I don't want to overplay my hand here, I guess. But
Sure.
my experience has mostly been very positive with clergy.
Mm-hmm.
That, right, especially if they have congregants and they have some amount of experience, they have a sense that people struggle with some of these kinds of things, and often they're actually really good at recognizing, maybe even better than outsiders, at recognizing when something's going wrong. They may not be equipped, or certainly not fully equipped, to offer the right intervention. But I mostly find that rabbis, when I talk to them, sometimes they reach out to me, sometimes I reach out to them, that they are very acutely aware of when somebody in their congregation this is not the right way. Like, this seems like anxiety has co-opted this area for this person. And their response isn't going to be to throw it all out. It's not like, well, now go eat a cheeseburger. But it's going to be like this person needs this is not what the experience is like for most people. So they're usually pretty good at getting that. And I think that if you can collaborate in a way that has trust in both directions, by which I mean that the clergy member understands that you're not trying to subvert the person's values or their religion. Really, to the contrary, OCD screws everything up when you let it into some area of your life, and that's true for religion too. It interferes with people's religious experience. It makes it miserable. It wrecks their relationship with God. We want to help them identify the OCD part, violate that without violating their values, so they can cut it out and they can live the values-driven life that matters to them. So you want to help the clergy person understand where you're coming from. And sometimes that also means helping understand the rationale for the interventions. So if we're doing exposure and we're asking somebody to approach something that might feel close to sin but is not technically prohibited, that's a weird thing to do from the like usually I think clergy are trained to avoid that sort of thing. And, to play it safe. And so you need to communicate, like, why we're doing this, but we're not doing this to desensitize somebody to sin. We're doing this for the following reasons and with the following goal. Of course, if you work with similar people over time, they understand this very quickly. But even if it's a new person, you communicate what you're doing and why. And I think it's actually quite helpful vis-a-vis OCD treatment itself for me not to be the religious expert. I don't want to build in reassurance. Jed said I can do it, therefore it's acceptable or something. So let's work together. I'm an expert in this, and I'm familiar with that being the religious rules, at least if it's with Judaism. And the rabbi or whatever other clergy member is an expert in religion and whatever the rules are of their faith or tradition. And they're not expert in this. And between the two of us, we can do a lot. I think also the framing of how you talk through that in other ways can be helpful, both in developing the collaboration and in modeling for the patient. So, for example, I might want to say to a rabbi, look, here's the problem, and this is what we'd like to do. We want to get as close as we're allowed to get to this sin for exposure reasons, et cetera, et cetera. What could we do that would violate this but would not be prohibited?
There you go. Yeah.
So now you're talking the same way. You're looking for ways to do it okay instead of, I want to do this. No, it's not a negotiation where you're arguing against each other. It's let's figure out how we can violate OCD without violating religion or whatever.
That's so important. And I think maybe a good message for new therapists who sometimes get overly exuberant in some of their ERP work. And when you said you wouldn't tell someone who is Jewish to order a cheeseburger, that's so true. Just like I wouldn't say to someone who's Catholic, let's use a Ouija board, because that's prohibitive in there. But like, you could go to a store that sells them in the toy aisle and not have to avoid the building totally, or something of that nature. Would you agree? Like, those are the kind of what you're talking about?
I would agree. And actually in any of these cases, I'm going to find out, I think, from the patient, even what they think. So let's say the Ouija board example, if it would turn out, or for somebody for whom even cosplaying Ouija board stuff, that when you're not taking it seriously, is that still a sin? Yeah, of course, we're not going to do it. But there might be some people for whom, like, wink, wink, this is an exposure. We don't really believe this, therefore we can play the game. Yeah. And it'd be the same with anything. I don't know that maps on super well to the cheeseburger example, but in Judaism too, there might be things where you can't say that. You can't. Actually, here's a good example. Something can come up in a lot of different ways, where there are certain things where either the language is prohibited, either if it has to do with vows or, let's say, cursing God or something like that. Mm-hmm. What if you're not? What if you don't really mean it? So, and an everyday way that might come up that people don't even pay attention to is if you're studying Talmud and you're speaking out a case. So let's say you and I are sitting there studying Talmud, which is a hilarious image in my mind for us to do. And you and I are sitting there, and I say to you, okay, so let's say this guy says, I hate God, curse God. Then what's going to happen is blah, blah, blah. So you're talking about a legal case, but you've said those words. And of course, immediately, so it's not the utterance of the words per se in a context that makes it obvious that I'm describing a case. Maybe there's still certain things you can't say. I don't know. But the point is, there might be things that depends on. I can't, let's say certain words that would curse God, but maybe I can describe what those words are in a legalistic case kind of thing. Anyway, the point being, it depends. We would need to know. There might be somebody who's comfortable with it, somebody who's not. There might be a rabbi who prohibits it, or a rabbi who permits it.
Mm-hmm. When bringing a clergy in, or a family member in, or a support person to the person who has scrupulosity, what are some of the messages you want to send to others who are in that support system to help describe what they might be doing, like reassurance that they're providing, or what we want to do and how we want to move to help the person? How do you kind of introduce that to everybody else? Because I'm assuming it's not always the easiest conversation to wait. You don't want me to tell them I'm praying for them or something like that, right?
Yeah, I wonder if I've never really thought through exactly if I have a rule about how that happens. I think that I usually try to involve the patient.
Cool.
So I think, I have one role with the patient, and it's not to be their friend, and it's not, like, we don't have to go out to the movies or dinner or make decisions about the kids or whatever. Like, we have a certain kind of relationship, but the spouse, to use one kind of example of what you're talking about, the spouse has multiple roles. And so I can't just say, I mean, maybe in some extreme cases I could, but I wouldn't normally want to just say to somebody, all right, don't do this anymore. They're going to ask for it. And so they're not even in the room, and I'm just conspiring with the loved one to cut some of that out. I would much rather that the patient, and maybe with my help, or maybe in the room while I'm doing it, whatever, but that the patient can communicate to the loved one, listen, I know that I often am asking you to do X, Y, Z for me. And It does make me feel better, and I sometimes feel the urgency for that in the moment. But in the long run, there's a big cost, and you can sort of explain what that is. And so I'm giving you permission. I want to sort of work on cutting that out. I'm giving you maybe as I'm giving you permission to do X, Y, Z, to respond in this way, and you can do that in a hierarchical way too. So it can be, right now I'm not sure that I'm able to give up such and such, but I'm working toward it. And so, maybe if I ask you for this the first time, maybe I just want you to say back, it sounds like you're asking for reassurance, or it sounds like you're asking for me to. And at least, for this week, let's try that. But if I come back and say I really need you to do this for me, okay, it's not your responsibility. That's on me. And maybe that can move along to a place where the person says, look, no matter what I say to you, after the second time I ask, you can just stop responding and say, this is the thing that you told me. I wish I could help. I love you very much, and I can't contribute to you still feeling this way and to your OCD. And so I'm going to do what you told me to do, or whatever. But the point is, the more you can involve the patient, I think, in those kind of guidelines, the more effective it's likely to be, the less they'll experience it as something being done to them. That's really hard, something done to you, as opposed to you choosing to do something hard. I don't know, but I'm curious if you have thoughts about that.
Similar, one of my go-tos is the worry book, where I have a book of questions that have been asked already, and I tell family members to write the questions out, write out the answers, and then just say that's in the book if that question comes up again. And some people might say, well, isn't the book reassurance? Well, the person with OCD really never goes to look at the book because they already know what the answer is in the book. We're just pulling them out of trying to, what I think of as a sneaky trick of OCD, which is, even though I've asked you this question 40 times and you've given me the same answer 40 times, I'm hoping on the 41st, you might slightly give me a different answer, which means that I can interrogate you for hours about why you gave me a different answer. And now we can continue to have this conversation more and more. So there's just this constant need of OCD, it seems, to get information and more information. But due to the insatiable nature of OCD, you can never give it enough for it to be fulfilled. And it's just going to keep begging and begging and pleading.
That's great. And one thing that I love about that is that, we're so used to, as OCD therapists, we're so used to being on the lookout for and teaching people not to do anything that's compulsive and not to have any reassurance, and for good reason. I'm not trying to say that that's not, yes, painting in broad strokes for sure, but you have to pay attention to the function of something. Something might be, but isn't that reassuring? Or you're writing it down. Yeah, but it functions for this person as a way to actually not do that, or as a way to, give up 10 other compulsions or whatever it is. And you sort of have to be, pragmatic a little bit and tethered to just, what's actually going to work and what's going to be the real effect, whether conceptually or not, that sounded uncomfortably close to reassurance.
I also have changed some language recently. I try not to, I still catch myself, but I try not to say sit with anxiety anymore. I try to say live with anxiety or doubt or discomfort, because people were thinking about, okay, I have to sit here until I'm not uncomfortable anymore, and then I can go live my life. But that's not really what we want people to do. We want people to go and live their life with discomfort and doubt and uncertainty and learn, I can handle that.
Yeah, that's great. And really, there's a tension in general with exposure therapy. To whatever extent it's about and then the anxiety will go down. And this is certainly the case when people use relaxation or something. But even in general, that's a mixed message. What we're trying to say is that it doesn't need to go down. It sucks. It's uncomfortable for sure. It's unpleasant, but it's benign, and you can continue to live your life like that. So that's great.
Yeah, your kid who you don't give candy to in the candy store eventually does move on to something else, even if the tantrum went for a very long time. And there might be one child in the world who's 40 who still says, "When I was 4, you didn't buy me candy." That is a possibility, I suppose. But the vast majority have moved on into other things in life, and so. I think though OCD is one of those things that just doesn't know how to move on. Just grabs one bad thing and says, yeah, but what if that happens again? And I wonder if you could speak maybe a little bit to that no matter how much somebody will study the Talmud, talk about Torah in your services, can you ever study it enough or read it enough to be 100% assured about anything?
Well, so actually built into the system, into the requirements, are guidelines that quite literally make that impossible. So one is
Fascinating.
expected to constantly be studying. One is expected to have time that they study every day. So there's a very explicit emphasis, not just on studying to know stuff, but on the process itself. The process is considered valuable. In fact, the rabbis say that the studying of that itself is even more important than the well, anyway, it's debated a little bit in the Talmud, which is more important. But the point is, right? No, it's never ending. It's intentionally never ending. There's intentionally inherent value attached to the process of it, and so you'll never know enough. You'll never be positive about everything, and you were never expected to be. There's the rabbis invoke the following expression when they're trying to figure out exactly what how extreme certain kinds of guidelines need to be. I know that's very vague. I didn't put that well, but in a completely legal and legalistic context, the rabbis will sometimes say the Torah was not given to the heavenly angels. The implication being, if God wanted perfection, there were divine related whatever beings that God could have said, do this and do it perfectly. And there can't be any standard or expectation that that is part of the Torah's requirement that a regular person wouldn't be able to satisfy.
Yeah, that's interesting.
With all the flaws, with all the mistakes. But there's no expectation of perfection, and it's explicit.
So what a great way kind of to bring us back to where we started. The idea that once there is an expectation of perfection, of absolutism, a pretty good then indication for us that OCD has joined the crowd and the chanting and everything, and we've moved away from the religious side of it to the OCD side of it when we get there.
Right. I think that's true. I do think that sometimes, especially for young people, they can take certain messages too literally and just need to sort of adjust, recalibrate off of that. So they can read rabbinic books, they can hear lectures and that sort of thing, and they can take them as quite literal. If this, it means that, and become very distressed. Whereas most people sort of implicitly are taking them as aspirational. Like, yeah, that's amazing, and that's something to strive. That it inspires me, and it's something to aspire to. And so, right, if that perfectionism is that red flag, it seems like OCD has crept in. And then sometimes also, again, especially young people are trying to figure out, with all the different kinds of messages they get, they're trying to figure out how much that really has to be perfect and that sort of thing. And so that people with more of an inclination toward OCD, people who are more anxious, are going to struggle with that more. But yeah, okay.
Jed, there's people out there right now wondering, should I go to treatment for this? Should I just study or pray more? What do you do to help turn the tide of there's help out there available?
Yeah, so you're not going to pray your way out of OCD. OCD is opportunistic. OCD latches onto what's important to you, especially if you're particularly religious or devout, or it matters a lot to you to get this all right. If you have OCD, that's going to be stuff OCD can use against you. And OCD is going to sort of co-opt your values and your religion and turn it against you and make it feel like a huge burden to you. You're not going to pray your way out of it. You're not going to wish your way out of it. There isn't going to be some sort of magical or religious, not to say those are the same thing, but some sort of shortcut where you can miss the hard work of dealing with OCD. But treatment for OCD can be really effective, and it does not have to violate your values.
No.
So if you're going to somebody, or if you're being told by some people that the only way out of this is to go back to the example I said before, to eat cheeseburgers or something, they might be well-intentioned, but they're wrong. It's not true.
Yeah.
All those people who are keeping these rules but don't have OCD that I was referring to before, they're finding a way. And if your only problem is that you don't like keeping the rules, that's not OCD. That might be that you don't like religion. But if you have OCD and it's latched onto these themes, you should be able to do first-line treatments for OCD, like exposure and response prevention, that can be tailored in ways that are effective without sacrificing either the values on one side or the mental health on the other side.
Dr. Jed Sieve, tell us about your lab, what you're doing, what you're studying, your students are working on before we wrap up here.
I'm really interested in scrupulosity, as you know, and other kinds of unacceptable thoughts. So in the lab, we've got studies going on with things like thought-action fusion, so the tendency to judge thoughts as being either morally or superstitiously equivalent to actions, trying to understand what's happening there, under what circumstances people get distressed about those sorts of things. We're interested in really sort of OC and OC-related cognitive processes more broadly. Fears of losing control is something that we've been talking about more in the lab recently, and I have a thesis student who's developing a study on fears of losing control. Sexual obsessions, and then, as I mentioned at the beginning, I've also gotten more involved in some psychedelics research as well, and I'm kind of interested in part of a clinical trial for psilocybin for OCD, and just learning more about what's potentially promising there.
Fascinating stuff. I did a chat with Carolyn Rodriguez about that. It was really, really interesting to talk to her about what we're looking at. Yeah. Well, thank you for joining us today. I really do appreciate it, and helping to educate our listeners about scrupulosity. It's a very important topic and nuanced in many ways due to all the various faiths and presentations and the ways that it will present to people. But if we know one thing about OCD, if it can find a way in, it's going to find a way in. That's for sure.
Thank you so much for having me. Always fun to get to chat with you.
Awesome. And thank all of you for listening to the Get to Know OCD podcast. If you're living with OCD, you can get better. The right treatment, you can learn to manage your symptoms and put yourself, not OCD, in charge of your life. So head to NOCD.com to become part of the world's largest OCD community and get connected with a highly trained therapist in the NOCD network. No matter what happens in your life and the experiences that you have with OCD, you're not alone. You can also work with someone to help you get better. We're really excited to keep doing the Get to Know OCD podcast, so you can find it on our NOCD YouTube channel and subscribe, or get it wherever you might subscribe to your favorite podcasts. We'll be back for another episode soon. Thanks again for listening. Have a great day.